Hi everyone. So I'm going to be talking to you a little bit today about some of the exciting research we're doing in our Health and Human Performance department on mechanisms underlying exercise included reductions in cancer-related fatigue. So I'll be talking a little bit about what cancer fatigue is, kind of some of the mechanisms that we've seen through research and what we've seen in our program, and then what we found as a result, and some future endeavors that we're going to explore. So what is cancer-related fatigue? Fatigue is typically a feeling of tiredness, but this kind of fatigue is different than what you might feel after a long day of work or a long workout. This is defined as persistent subjective feelings of tiredness that are related to cancer or its treatment, and it really impacts the daily lives of the individual. It can be physical, so they'll feel weakness in their muscles. It can be emotional, so they won't be excited by things that they're normally excited by. Or it can be cognitive, so they don't have the same concentration capabilities. And the key here is that this fatigue is not proportional to activity or rest. So they could take a nap all day long and still feel this fatigue afterwards. And the main thing with cancer-related fatigue is that it lasts years after treatment. So it's not just from the treatment or the cancer itself, but it's years into when they are a survivor of cancer. So why do we study it? Well, as science and technology and medical are advancing, we have an increased number of survivors. So the American Cancer Society says that we have about 15.5 million cancer survivors in the U.S. today, and that number is expected to increase to 20 million by 2026. So there's a lot of survivors, and cancer-related fatigue has a 60 to 90% prevalence rate in survivors lasting years after treatment. So this has a big impact on their quality of life. So we're healing them from their disease, but their quality of life is still suffering a long time afterwards. So we're really interested in figuring out what really causes this symptom, and that way we can tailor treatment to it. A lot of our understanding of cancer-related fatigue, because it hasn't been researched too extensively, is based on other understandings of fatigue-related disorders, such as chronic fatigue or exercise-induced fatigue. So these are a good example of some of the causes that we have found through research. It could be related to the cancer itself or the treatments they undergo, so the chemotherapy, the medications that all affect their bodies. Some of the surgeries that cause pain to them can induce fatigue. Any pre-existing disorders like anemia, which affects your oxygen in your blood and relates to fatigue, or a sedentary lifestyle with poor nutrition, all can relate to cancer fatigue. So if any of these things pre-existed before or happened during treatment, you're going to have cancer-related fatigue afterwards. So a mechanism of fatigue is, again, something that kind of causes fatigue. And so this could be related to the immune system and how your immune cells communicate with each other and fight off infection. It could be neural, so the weakness of their muscles could be because their nervous system is not communicating appropriately with those muscles. Or what we're going to focus on for our research is the hormonal dysregulations. So this could be anything from serotonin, which affects your sleep, to the stress hormone cortisol from the HPA axis. The HPA axis is the hypothalamic pituitary axis, and it's basically the main regulating system for cortisol in your body. So what it does is it can affect your blood pressure, your cardiovascular functioning, your immune system, even your metabolism can all be affected by HPA and cortisol. So a dysfunction in this has been shown through research in both ovarian and breast cancers. And so we're trying to see how that relates to more cancers and how this relates to cancer-related fatigue. A little bit more about cortisol is that while some studies done have showed that there is a low level of cortisol in fatigue in cancer-related fatigue survivors, there is also a dysregulation of the diurnal cortisol slope. So diurnal basically means like your daily values. So cortisol is for the fight or flight response, right? So you'll have a high peak of it during the morning when you need to get up and get ready, make your coffee, go on with your day, right? And then around 11 a.m., you'll see it start to drop off. And that helps you rest and recover and go into those mechanisms of the body that are really important. So what was found was with cancer survivors experiencing fatigue, they have a flattened slope of cortisol. So that's shown in the top line on the bottom graph. So you can see that their slope is significantly higher in the end of the day and almost a little bit lower in the beginning of the day as well. So they're having off levels throughout the day. Another functioning of cortisol is its response to stress. So when you encounter a stressor, you'll usually have a spike of cortisol that helps you prepare for your fight response. So what was found was when a study took cancer survivors that were experiencing fatigue and compared them to healthy individuals that underwent the same stress test, they found that the cancer patients with fatigue had, this is on the bottom line here, they had hardly any response to the stress and cortisol at all. And the top one, they increased their cortisol concentration, so they were ready for the stressor. So there's definitely some kind of dysregulation with both the response of cortisol and the daily output of it. So how does this all relate to exercise and what we're doing in our program? First, exercise is established as effective in reducing cancer-related fatigue by a number of studies. In 2009, there was a study that took almost 305 cancer patients, and they had them undergo 8 months of exercise, and they found 75% reductions in cancer-related fatigue. So that was really successful, and then we again saw it here in our program at PBA. This study was actually published in 2016, and even though we had a small sample size, it was still significantly reduced levels of fatigue. That'll just continue to be improved by further programs. And then finally, exercise seems to be a regulatory mechanism for cortisol. So in a study of 8 men and 13 women who were untrained, they underwent 8 weeks of exercise, and they found that they had an acute increase of cortisol during exercise and an actual decrease of cortisol at rest. So this, they concluded, was a regulatory effect of the normal responses for cortisol. So what we would assume for our program is that if we see reductions in fatigue because of the exercise, we would hope to see a reduction of cortisol as well. This is an overview of everything we did in our program. As you can see at the top, there's a timeline of 8 weeks, which is how long we had them participate. T1 is everything we did prior to the program, and T2 is everything we did post-program. And then blue is everything in between. So prior to the program, we made sure that they were cleared by their doctors to participate. That was the number one most important thing, making sure the health of the individual is maintained. We had them undergo a few tests to see where their baseline levels were. So for cardio, we did a 6-minute walk test, just seeing how far they could go in 6 minutes. We also did a number of strength tests, like a sit-stand test, and different things for your bicep strength or hip strength. We took resting levels of heart rate and blood pressure, and then also a preliminary FSI score. So an FSI is a fatigue scale inventory, and this is basically a questionnaire where they can report on their perceived levels of fatigue in different questions. So this will measure intensity, interference, and duration of fatigue. And then finally, before the program started, we took a salivary sample. So this was so that we could measure our cortisol. Now, saliva is a good representation of cortisol circulation in the body, and so we decided to use that for ease of extraction and use. And what we did was we made sure it was at 10:30 to 11:30 a.m. So anywhere in that time frame, because of the diurnal nature of cortisol, we really wanted to eliminate the variable of time. So throughout the program, we had them meet 3 times a week for an hour. So each session, we would take heart rate, blood pressure, and weight sometimes. And that was to maintain the health of the individual, make sure they're responding to exercise appropriately. We'd have them undergo 10 to 30 minutes of cardio, and this would be all low impact. So we would have them walk on a track or a treadmill or a recumbent bicycle or an elliptical, something like that. And then for the resistance training, there was 20 to 30 minutes of that, depending on how much time was left. And they would use a lot of the machines in the gym to maintain form so that we would reduce the risk of injury. We would do things like leg press or tricep press, lap pull downs, some things like that. And then each Friday, we took their FSI score. So we wanted to see kind of what they started off on and how they changed throughout the program. And then finally, after the program, we repeated all the preliminary testing to compare pre to post, and we did the same with the saliva samples. Once the saliva samples were all taken, they were stored in the freezer for about a month or so until we could analyze them, and then we analyzed them according to the Salometrics immunoassay kit protocol, which basically we just mixed the saliva samples with a bunch of enzymes and buffers and substrates and all these kinds of things to get an output of data that we could calculate concentration of cortisol from. So this is a good representation of kind of what we did in the program. We had participants work one-on-one with students, which was really exciting for both the student and the participant. I just heard amazing things about how each person benefited from that time. We also had Dr. Sylvester, who helped teach some of the students more clinical applications for things they could do, like taking a blood pressure, which they might not have gotten in another setting. Some of the results that we got were as expected. So for our fatigue scales, we expected them to reduce, and they were significantly reduced pre to post in our study. So with the fatigue scale, it's not meant to be an average of all of the questions, but it's rather meant to be broken down into intensity, interference, and duration. So you can see the average here, which we still see a decrease, but the more important one is the bottom graph, because this is a representation of the interference of fatigue in their daily lives. So this is a sum of questions 5 through 13 of the interference questions. And so that was significantly reduced. We also looked at a few questions in particular. So question 5 was on interference with daily activity. And so it would ask them, like, how much did your fatigue interfere with your activity this week? And that was significantly reduced. And so we can conclude that, our patients had more energy to be active after the program, which is very beneficial towards maintaining the progress that they had in the program. And then for question 3, that was the average level of fatigue, which we can also see a significant reduction in. Our muscle strength improvements, unfortunately, were not as significant. So we had a few significance in the right hip strength. So we could see that increased from about 34 pounds to 37.5 pounds. So that's just their strength increases pre to post. And then the sit-stand, we had individuals sit down in a chair and stand up as many times as they could within 15 seconds. And that helped, measure balance or leg strength. And that was significantly improved as well. However, other things like our bicep strength or our left hip strength even were not as significant, and that is due to lack of data. The reasoning for that is because of the nature of our population. Since they are cancer patients, sometimes they have to go back for treatment, or life gets in the way, or just other things happen where they are not able to perform these tests or come in for these tests. And so we had a little bit of a lack of data there, so that reduces significance. Finally, with our cortisol analysis, we did not find a significance pre versus post, but we did see a small trend. So the graph here depicts the average cortisol of the samples pre versus post, so we did see a small decrease. Now this is as expected because, like we saw with the diurnal graph, around 11 o'clock is when they should be decreasing their cortisol levels. So if they have too high of a cortisol level at that time, that would be considered fatigue level. So even though it was not significant, we do see a trend which is positive for us and hopeful that next time when we have a larger sample size, it will be significant. We only had about 12 participants that were eligible for the cortisol analysis because we only had 12 that completed the 8 weeks of the program, so we could have pre and post. So next time, that's definitely something that we would hope would improve. For the future of this study, we're going to continue taking salivary samples before each program now for 2 reasons. We're going to continue to do the cortisol testing, which will help increase our sample size, and hopefully we'll find significance there. And then secondly, to study C-Reactive Protein. So C-Reactive Protein is a protein that is released from your liver to help indicate disease, or in this case, fatigue. So what you could hypothesize is that if there's some kind of relationship between exercise, reduced fatigue, and cortisol, we should also see a reduction in C-reactive protein in the individual as well. Some things we might change would be, increase our sample size if that's possible, Definitely monitor carbohydrate consumption, because what we found was, I remember some individuals that came in and they said they had like a sugary coffee beverage right before, or one person even came in with a lollipop in her mouth. And those sugary rich foods really mess up the pH of the saliva sample. And so what that does is when you put it into the kit, it messes up the enzymes of the kit, and then it doesn't output the right data. So that's something that we would monitor for next time. Another direction we could go is monitoring sleep patterns as well. I know before at PBA there's been a student that studied sleep patterns with a Fitbit. So we could, put the cancer patients with a Fitbit and kind of connect cortisol to circadian rhythm and that kind of thing. As far as the program goes, it's continually growing. I remember when we had one session every, 3 days, and maybe 15 participants in it, maybe 15 students. And now we've doubled that. We have 2 sessions, Monday, Wednesday, Friday, and we have at least 30 participants that begin the program, and the same number of volunteers. Like, it's just growing so exponentially that it's really beneficial for research in our department, because a lot of students are getting more interested in the cancer patients and how they can help and find things that will help them. So, for example, a few students have proposed that they're going to do biological indicators of the GI tract for upcoming programs. And so they have this hypothesis that there's some bacteria that's normal in your gut, and then that can be altered somehow with fatigue, and they're going to kind of see like how that matches up. Other mechanisms that we could do would be to study 3D motion analysis, which will give us an idea of how the functionality of the individual improves throughout the program. So it'll analyze kind of how they walk, so their gait, or it can analyze how much force they put on one leg versus the other leg and see how that improves during the program as well. And then finally, the psychology of fatigue would be an interesting study. We already have the FSI scores. We can do other questionnaires that'll help us to understand more of, how their reduced fatigue affects their motivation or their outlook on life. Because that's really the main goal here, is to understand the mechanism so that we can tailor the treatment to help restore their quality of life. All right. Thank you. Any questions?
So would it be possible to take this program to cancer centers, and that way you get a better sample or better group of participants? Not a better, but a larger.
I know we're definitely trying to reach out to the community more. That's been one of the things that we've been working on in the lab a lot. And so I know that the advertisement, I guess it's not the right word, but of the program has gotten out there. So the patients that have been successful here, they do tell their friends, and their friends come in. So we get more and more people every year. But it would definitely be something interesting to see if there's any cancer centers nearby that would be interested in it. That would definitely help with the sample size, which is probably our main issue here.
So of all these things you talk about, future you look at, what are things that, as you research this and you've worked with patients a lot, what are some things here that you think might be most beneficial for them to understand? And these things that are interesting to look at.
Mm-hmm.
What, from your perspective, if you had another grant and you had more time, another degree to get, what would you be interested in? Why?
Well, I know a lot of the cancer participants, when I was doing this study, they were really, really interested in it, and they wanted to know everything that I was learning. They were always asking me, like, what the next thing that they were learning, and kind of what they could do to help with, finding the results that I was finding in my research. So that's why I think things like the cortisol or the C-Reactive Protein, if those are related to exercise, that would be a main thing for them that they would focus on, because that's something that they can control. You can't always control the bacteria in your intestines, but you can control how much you exercise. So, I know they're extremely motivated. They always say that after the program, it's like the best antidepressant. They're always so high on life and excited for everything. So I think if we can connect these indicators to exercise and how that reduces it, that would be probably the main thing I would focus on, because it's something that would motivate them in their daily lives.
And I guess related to that, we show the pictures that each of those, there's a subject who's with a student. like that. I guess I'm wondering what your thoughts are. Is some of what you're looking at, how much of the social component is a factor to the fatigue scores, to some of the psychological part?
True.
And is that something maybe look at more future-wise?
We could probably study that. I'm not sure on how we would do it, but I'm sure there's some kind of psychological questionnaire that we could give them as well with the FSI scores. I mean, they always say, like, it's easier to work out when you're going with a friend. So I know that it was a big motivation for a lot of the participants to be able to come and talk to the students and kind of invest in their lives. You know, they would always give us their little pieces of wisdom from their lives, and they would like to hear about our like tests or stresses or anything like that. So it was definitely motivation to be able to come and do it with someone, and then also with the other participants there that were going through the same thing. They could swap stories about what they've been through. And so I definitely think there's something to the social aspect, at least psychologically. So that would definitely be something to look into. Any questions? Thank you.
Very good.